Welcome to the deep dive. Today we're tackling something that causes, I think, a lot of confusion and frustration. Figuring out the right skincare routine if you've got acne-prone skin.
Yeah, it's a minefield out there, isn't it?
Ugh.
So much advice, sometimes conflicting.
Totally. So we've gone through the sources,
Yeah.
and our mission today is pretty clear. Break down the 5 essential steps, highlight the must-have ingredients, and maybe point out some common mistakes people make.
Exactly. We want to give you a clear, actionable plan based on what the research actually shows.
Okay, let's unpack this then. First things
Yeah.
first. How do you even know if this advice is specifically for you? Like, what are the signs of truly acne-prone skin?
Good question. Well, the most obvious sign is, regular breakouts. We're talking consistent whiteheads, blackheads, maybe even those deeper inflamed spots like cysts or papules.
Right. And it's not just the pimples, is it? The sources mention things like excessive oiliness.
That constant shiny look.
Yeah. And maybe a rough kind of skin texture, visible pores.
Mm-hmm.
And here's a big one they pointed out.
Yeah.
Sensitivity. If new products often make your skin red or irritated or cause more breakout.
That's a huge clue. It suggests your skin barrier might already be a bit compromised, which is really common with acne-prone skin.
So if that sounds like you, consistency is apparently everything.
Oh, absolutely. You can't just treat spots as they pop up. A consistent routine actually gets ahead of the problem. It tackles the root, causes the oil, the bacteria, the dead skin cells building up.
So it's about prevention, really. Less inflammation, fewer breakouts over time.
Precisely. And that structure you mentioned, the 5 core steps, that's the foundation. But what you use in each step, that's where the real magic happens.
Or where things can go wrong, I guess.
Exactly. What's fascinating here, I think, is the level of intention you need at every single step. It's not just general skincare, it's targeted.
Okay, let's dive into that 5-step blueprint. Step 1, cleansing. Morning and evening.
Yeah.
Pretty basic goal, right? Just get the grime off.
Sort of. Yes, remove excess oil, makeup, dirt, pollutants, anything that could clog pores. But the how matters.
Ingredient-wise, what are we looking for?
You want cleansers with active ingredients. Things like benzoyl peroxide that's great for killing bacteria. Or salicylic acid, which is brilliant at getting into pores and dissolving clogs. Sulfur is another good one.
What about soothing stuff? Because some of those sound quite strong.
Good point. Yeah, look for things like green tea, aloe vera, maybe chamomile ingredients that can calm the skin while the actives do their work.
Now, I know a lot of people, especially with oily skin, love that super tight, squeaky clean feeling after washing. Is that actually good?
No. That's usually a red flag. That feeling often means the cleanser is too harsh. It's probably stripping away your skin's natural oils, its protective barrier.
And then the skin panics.
Exactly. It tries to compensate by producing even more oil, so you end up oilier and potentially more irritated. So the big avoids here are harsh sulfates, alcohol, strong fragrances, and definitely no gritty physical scrubs in your daily cleanser.
Okay, got it. Clean, not stripped. Moving on to step 2, exfoliation. This is less frequent, right? Only like 1-2 times a week?
Correct, and preferably in the evening, so your skin has time to recover overnight.
And here's where things get interesting based on the sources.
Yeah.
The focus should be on chemical exfoliation, not scrubbing your face raw.
Yes, absolutely. Physical scrubs can be way too abrasive, especially on inflamed skin. They can cause micro tears and worsen irritation. Chemical exfoliants work differently.
How so?
They use mild acids to gently dissolve the glue holding dead skin cells together. This helps unclog pores, improves texture, and actually helps your other products absorb better.
So what kind of acids are we talking about?
Mainly BHA's beta-hydroxy acids, which is basically salicylic acid again. It's oil-soluble, so it penetrates pores really well. Or AHA's alpha-hydroxy acids, like glycolic or lactic acid, they work more on the surface.
And you need to start slow with these.
Definitely. The sources suggest starting with maybe 1 or 2 times a week. And look for lower concentrations initially, perhaps 5–10% glycolic acid or 0.52% salicylic acid. You can build up tolerance, but pushing it too fast will just irritate your skin.
Okay, gentle chemical exfoliation, not too often. Step 3, toners. Morning and night. What's their job exactly? I feel like toners get a bad rap sometimes.
They used to. The old school ones are often full of alcohol and just strip the skin, but modern, well-formulated toners are different. Their job is to remove any last traces of cleanser or impurities.
Like a final cleanup crew.
Kind of, yeah. And they help balance the skin's pH after cleansing and just prep the skin nicely for whatever comes next, like serums or treatments.
What should be in a good toner for acne-prone skin? and what shouldn't?
Again, alcohol-free is crucial. Look for ingredients like perhaps a little salicylic acid for continued pore clearing, maybe witch hazel for some temporary oil control, or antioxidants like green tea. Just absolutely no alcohol, no menthol, nothing overly astringent or fragranced.
Got it. Alcohol-free is the key. Now, step 4. Moisturizer. You flagged this earlier. Skipping this is a mistake, even if your skin feels oily.
Yes, this is probably one of the biggest myths in acne care.
Okay, explain why. It feels backwards to add moisture to oil.
I know it does seem counterintuitive, but when your skin is dehydrated, which can happen even if it's oily, especially if you're using drying acne treatments, it triggers your oil glands to produce more oil to compensate.
Ah, so drying it out actually makes the oiliness worse in the long run.
Exactly. You need to give your skin the hydration it needs, but in the right form. That means looking for moisturizers that are specifically labeled oil-free, gel-based, or water-based.
And that magic word, non-comedogenic.
Yes. Non-comedogenic. Let's break that down quickly.
Please do.
It basically means the product has been formulated and tested to not block your pores. It's not a 100% guarantee for every single person, but it significantly lowers the risk.
Okay, so non-comedogenic, oil-free, what ingredients are good to see in there?
Look for things like niacinamide. That's a fantastic ingredient. It helps regulate oil production. It's anti-inflammatory. It can even help with redness in pores. Also, humectants like hyaluronic acid or glycerin, they draw moisture into the skin without being heavy or greasy.
And what are the big no-nos in moisturizers for acne?
Definitely avoid heavy oils like coconut oil, for example, which is notoriously pore clogging for many. Avoid thick, rich creams. And be wary of occlusive ingredients.
Occlusives, like what? Petroleum jelly?
Yeah, petrolatum is a classic occlusive. Some heavy silicones can be too. They work by forming a seal on the skin to stop water loss. Great for very dry or compromised skin, but for acne-prone skin, they can trap oil, dead cells, and bacteria underneath, leading to more breakouts.
Makes sense. Okay, that brings us to the final core step, step 5, sunscreen. Every single morning. Non-negotiable.
Absolutely non-negotiable. This is so important for anyone, but especially if you have acne.
Why especially? Is it just the usual anti-aging skin cancer prevention?
That too, of course. But for acne sufferers, there's a specific reason. Preventing and fading post-inflammatory hyperpigmentation, or PIH.
Ah, those annoying dark or red marks that stick around for ages after a pimple heals.
Exactly. Sun exposure makes those marks darker and much harder to get rid of. Daily sunscreen use is your best defense against them forming and sticking around.
Okay, so what kind of sunscreen is best?
The sources generally lean towards mineral sunscreens for acne-prone skin. Those use zinc oxide or titanium dioxide.
Why mineral over chemical filters?
They tend to be less irritating for sensitive acne-prone skin. They sit on the surface and reflect UV rays rather than absorbing them like chemical filters, which some people find can cause stinging or breakouts. Look for formulas labeled oil-free and non-comedogenic, obviously. A matte finish is often preferred too.
And application matters too, right? You can't just dab a tiny bit on.
No, you need a decent amount for proper protection. The guideline is usually about a quarter teaspoon just for the face, which sounds like a lot, but it's necessary. And reapply every 2 hours if you're out in the sun.
What ingredients should we avoid in sunscreens, besides the obvious oils?
Avoid heavy fragrances again. And some chemical filters are more commonly associated with irritation or potential pore clogging, like oxybenzone, avobenzone, octinoxate, octocrylene. Sticking to zinc oxide or titanium dioxide is often a safer bet if you're sensitive.
Okay, that's the core 5 steps nailed down.
Mm-hmm.
What about going beyond that? Any extra boosters or treatments?
Yeah, once you've got that core routine solid, you can add things in, like maybe a clay mask once a week to help with oil, or a sulfur mask, which is antibacterial. Targeted spot treatments are useful, too, for individual pimples.
Using ingredients like benzoyl peroxide or salicylic acid, right?
Exactly. Or maybe even a spot treatment with a low-strength retinoid, like adapalene. Serums can also be added, maybe niacinamide for oil control and pores, vitamin C for brightening and antioxidant protection, or a prescription retinoid if needed.
Let's zero in on those key active ingredients we keep mentioning. Salicylic acid, what's its main job again?
Salicylic acid, or BHA, is oil-soluble. So its superpower is getting deep into the pores to dissolve oil and dead skin cells. It's also anti-inflammatory, great for blackheads and whiteheads.
Okay. Benzoyl peroxide.
That's the bacteria killer. It releases oxygen into the pore, which kills the P. acnes bacteria that contribute to inflammatory acne. It can be drying, though, so start low and slow.
And then the big guns. Retinoids? like adapalene, which is over the counter now, or prescription tretinoin?
Right. Retinoids are vitamin A derivatives. Their main job is to speed up your skin cell turnover. This helps prevent dead cells from clogging pores in the first place, and it also improves skin texture over time.
But these have a reputation for being tricky to start with.
They do. There's often an adjustment period, sometimes called purging. Because they speed everything up, they can bring underlying congestion to the surface initially, leading to temporary breakouts. Plus, dryness and irritation are common at first.
Patience is required.
Absolutely. You must start slowly, maybe just twice a week, use only a pea-sized amount, and buffer it with moisturizer. It's a marathon, not a sprint, but they can be incredibly effective long-term.
Okay, good to know it's normal, that purging. What about niacinamide and zinc?
Niacinamide, like we mentioned for moisturizers, is fantastic. Regulates oil, strengthens the skin barrier, calms inflammation, helps fade those post-acne marks. It's a real multitasker. And zinc is primarily known for its anti-inflammatory effects, helping to calm down red, angry pimples.
Got it. So we know what to do. Now let's flip it. What are the biggest mistakes people make? The things that totally sabotage even a good routine?
Oh, there are definitely a few common pitfalls. The first one we already touched on, over-cleansing and especially over-exfoliating.
Thinking more is better.
Yeah, stripping the skin, damaging that barrier. It just leads to more oil, more irritation, more breakouts. Stick to exfoliating just 1-2 times a week max.
Another big one seems obvious, but
Ugh.
picking or popping pimples.
Huge mistake. It feels satisfying for a second, maybe, but you're pushing bacteria deeper, causing more inflammation, risking infection, and almost guaranteeing scarring or those dark marks. Just don't do it. Lab extractions to the professionals if needed.
And using the wrong types of products, even if you have the steps right, like those heavy occlusive ingredients you mentioned.
Exactly. Using moisturizers or sunscreens with pore clogging oils like coconut oil, isopropyl myrostate, or heavy creams, or using products loaded with irritants like alcohol or fragrance, which just fuel the inflammation cycle.
Okay, those are skincare mistakes. What about things beyond products? Lifestyle factors.
Yeah.
The sources mention stress quite a bit.
Yes, stress is a major trigger for many people.
How does that work? Why does a stressful week suddenly show up on your face?
Well, stress triggers the release of cortisol, our primary stress hormone. Cortisol increases inflammation throughout the body, including the skin. Plus, stress can also increase androgen levels.
And androgens drive oil production, right?
Precisely. So more stress equals more oil and more inflammation, a perfect storm for breakouts.
So finding ways to manage stress, like the sources suggest, yoga, meditation, getting enough sleep, exercise, that's actually part of an acne management plan.
It really should be, yes. It's addressing an internal trigger.
Diet is another big one mentioned. Does what you eat really affect your skin that much?
The link is complex and still being researched, but yes, for many people, diet plays a role. Acne is fundamentally inflammatory, and diet directly impacts inflammation and hormones.
What kind of foods are often flagged as potential triggers?
High glycemic index foods are frequently cited. Think refined carbs, sugary drinks, white bread, things that spike your blood sugar and insulin levels quickly.
And that insulin spike can lead to more oil and inflammation.
That's the proposed mechanism, yes. It can stimulate oil production and inflammatory pathways. Dairy is another one sometimes implicated for some individuals, possibly due to hormones in milk.
So the advice is generally to focus on
What?
lowering inflammation through diet.
Pretty much. Eating a balanced diet rich in antioxidants, lots of colorful fruits and vegetables, getting enough omega-3 fatty acids from things like fatty fish, focusing on lean proteins and complex carbohydrates for more stable blood sugar. It's about overall health, which reflects on your skin.
And one last simple thing, basic hygiene.
Sounds basic, but it matters. Keep your hands off your face as much as possible. Hands carry dirt, oil, bacteria. Same goes for hair, especially if you use oily hair products. Clean your phone screen regularly. Wash your pillowcases often. Little things add up.
Okay, so we've covered the routine, the ingredients, the mistakes, the lifestyle links. But what if someone tries all this? They're really consistent, and it's still not working.
That's when it's definitely time to see a professional. If you've given a good over-the-counter routine, like the one we've discussed, a solid go for maybe, say, 3 months and you're not seeing significant improvement, book an appointment with a dermatologist.
What can they offer that you can't get over the counter?
They can properly diagnose the type and severity of your acne and offer prescription-strength treatments. This might include oral medications.
Like antibiotics.
Sometimes, yes. Short courses of antibiotics like doxycycline or minocycline can help reduce bacteria and inflammation internally. For women experiencing hormonal acne, they might prescribe spironolactone, which blocks the effects of those androgen hormones on the oil glands.
And what about the really severe cystic cases? Is that when treatments like Accutane come in?
Yes, isotretinoin, the generic name for Accutane, is usually reserved for severe, persistent scarring acne that hasn't responded to other treatments. It's very effective, but comes with significant potential side effects and requires strict monitoring by a doctor.
So it's powerful, but definitely needs expert supervision.
Absolutely. And dermatologists can also perform in-office procedures, things like stronger chemical peels than you can do at home, professional extractions to safely clear out stubborn blackheads and whiteheads.
Which is much better than picking.
Much better. And for those really deep, painful cystic spots, they can sometimes do intralesional corticosteroid injections to quickly bring down the inflammation and pain.
So the takeaway is don't struggle alone indefinitely. Professional help is available and can make a huge difference.
Definitely. If we connect this to the bigger picture, getting that expert diagnosis and tailored plan, maybe combining prescriptions, procedures, and the right supportive skincare often gives the best long-term results for persistent acne.
Right. And the payoff for getting this right, whether through diligent home care or professional help, is pretty significant, isn't it?
Huge. We're talking fewer breakouts, less redness and inflammation, smoother skin texture. And honestly, the boost in self-confidence that comes with clearer skin is immense for many people.
On the flip side, what happens if you just ignore
Mm.
persistent acne? Hope it goes away.
Well, unfortunately, it can lead to long-term problems. Permanent scarring, both pitted scars and raised scars, is a major risk with inflammatory acne. And that post-inflammatory hyperpigmentation, those dark marks, can last for months or even years if not managed properly, especially with sun exposure. Plus, ongoing inflammation isn't great for overall skin health and barrier function.
Taking control is really important for long-term skin health, not just appearance.
Absolutely.
Okay, before we wrap up, let's leave our listener with something to think about. You mentioned the diet link.
Yes. So here's a final thought. Since we know diet, particularly high glycemic foods, can potentially influence hormones and inflammation, maybe consider a little experiment.
Okay.
Try keeping a simple log for a few weeks. Note down your skincare routine, any breakouts, and track your intake of those potential trigger foods, sugary things, refined carbs. It's not about being obsessive, but about awareness.
So connecting the dots between what you put in your body and what appears on your skin.
Exactly. It might help you identify your personal internal triggers, giving you another layer of control beyond just the topical routine. It adds that internal piece to the puzzle.